Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome to Gateway Today, the show that brings you closer to Gateway Community Health Center. I'm your host, David Cash Vasquez, and today we're taking you through a special journey revisiting the key highlights of our show from the past year, from resident doctors to dietitians, dental services to pharmacy, and even taking you outdoors. We've got a lot in store for you, so we want to remind you to make sure you visit gatewaychc.com if you'd like to become a patient of Gateway Community Health Center. It's easy. Log in from your desktop or your phone and experience the best in high quality medical, dental, and behavioral health care. For now, our journey begins with resident Dr. Courtney Campbell. Dr. Campbell was our very first guest on the show, and we take a look back at her wisdom on how each of us can be our own health advocate right here at Gateway Community Health Center.
As much as I love to treat disease, I want to prevent disease, and this is kind of the population that needs it the most. How do we get the patient to participate in their healthcare? How do we get them from being scared of going to the doctor to not only comfortable going to the doctor, but also comfortable asking questions and taking an active participation in their health? And I think a lot of it, we have to empathize with the patients. They don't have the same background that we do. They may not know that something is worth mentioning or whether it's not. They may not know that they should ask this question. And so being more investigative, and when patients don't volunteer too much, sometimes you have to do a little digging and they are like, oh, I didn't realize that was abnormal, and so we always have to review all of the systems to make sure. But in terms of getting them to be more active and engaging in their health, I think explanation is really important. I think sometimes doctors, they feel frustrated that it's difficult to explain health. But I think if you can break it down to its rudimentary elements and you can get anyone to understand the consequences of X, Y, and Z, the importance of getting something checked, and just giving them that education, I think that's the first step in giving them the confidence to ask questions. Because if we're just telling them that you have diabetes, you need to take these medications, but we're not opening the floor for questions and kind of instilling the curiosity into their own lifestyle. Like, I like to ask, what do you think it is that you're doing that may be contributing to this issue? And asking open-ended questions and trying to engage them in their healthcare is also really important.
We appreciate Dr. Campbell's insights, a true advocate for personal health. Now, let's move on to the realm of oral health. Some of you may remember we got a chance to talk to dental hygienist Davine Borchers-Agüero, who shared 3 key tips to better oral health. Check it out.
There are 3 things that we should do in order to keep our teeth and gums healthy. And actually it should be, or I should say, try to keep our teeth and gums healthy, because even though we practice those 3 things, it's not a guarantee that we're gonna have complete oral health. But those 3 things are, the first and foremost and most basic is brushing. We should brush our teeth 2, preferably 3 times daily. The second thing we should be doing is flossing. We should floss once daily. And lastly, we should be having our teeth cleaned minimum twice a year.
Our thanks to Davine for reminding us that a great smile is priceless. Up next, we're staying in the world of advanced dental technology with Director of Dental Services, Roxana Preston. You may remember we went to visit her at our state-of-the-art clinic at Laredo College South. Check it out. All right, so as part of that technology and that advancement that Gateway is investing in, we wanted to kind of get a closer look at some of the imaging that happens right here in our dental department. And so, Ms. Preston, show me a little bit about the differences between the imaging, right? So right here, we've got a 2D image, which most traditional dental services have, right?
Yes, most general practices will have the 2D images. panoramic x-ray. These are bite wings and PAs that show different parts of, the teeth. The bite wings really focus on the in-betweens, which are very important, and the PAs focus on the roots of the teeth to make sure, for looking for infections or anything like that. So this is an example of a 2D image.
So, and all of our clinics do this, right?
Yes.
Okay, but when we jump into 3D, this is the special little nugget with Gateway Community Health Center here at LC South is our 3D imaging. Show me that, because I think that's really the cool little piece to our dental department right here. I mean, just look at the cool image that you get out of this. So this is a test image that we have, and you can literally, like I said earlier, you can kind of go up, down, all around, right, with this image?
We could do a little bit of things, a lot more. We can, like I said earlier, you could take a look and certain developments will tell you how many roots teeth have for, molars and stuff like that, and it'll show us different angles.
This is like CT scan technology for your teeth, right?
Yeah, and it even treatment plans, stuff for endo. We could take specific x-rays for a tooth that may require endo or crown, sleep studies, airways, all of that fun stuff.
So if you wanted to look at the bottom of the tooth, you could look at the bottom of the tooth. If you wanted to look at the top of it, side, you get all of this imaging, and then this helps the dentist, right, diagnose certain conditions within the patient, correct? Yes. Wow. It's not just technology, it's people like Roxana Preston who make our dental services top-notch. We also remind you that if you're living near or in the area of Laredo College South, stop in and get your medical and dental visit done today. After the break, we're diving into the world of medication with Dr. Cesar Manuelos at Gateway's Pharmacy, so stay tuned. Gateway Today returns in just a few moments.
Remember, you are not alone. If there is a crisis, call 988. We answer in English and Spanish. This is a crisis and suicide hotline. You are not alone. 988.
You're not alone. You're loved. Call the Suicide and Crisis Lifeline. Dial 988. You're loved. We need you here.
To all my veteran brothers and sisters, just so you know, you're not alone. Dial 988 Suicide Crisis Hotline.
Hello everyone, I'm Jesus Torres. I'm retired Assistant Chief of Police from the City of Laredo after 38 years of service. So I'm here in support of Coalition 988, Suicide and Crisis Lifeline. You are not alone. And I'm telling this to the entire community here, all retired police officers, active law enforcement, all motorcyclists out there that we have. I belong to a couple of clubs of motorcycles. So, we're out there. You're not alone. You have any issues, just pick up the line. 988 is the time to call.
Para todas las personas que estén sufriendo de crisis mentales, con ideas suicidas, siempre pueden llamar al 988 a cualquier hora durante los 365 días del año. Recuerden, no están solos.
Remember, you're not alone. Please call 988 for help.
Recuerda que no estás solo, eres importante. Si necesitas ayuda, llama al 988.
Don't forget this phone number, 988. You are not alone. There are plenty of resources available for us to help you. Remember, asking for help is a sign of bravery. 988, 24/7, help is out there for you.
No están solos, llamen.
988.
We ask everyone to dial 988.
You are not alone.
Welcome back to Gateway Today. Well, before the break, we left off on the important topic of easily accessing medication with Dr. Cesar Manuelos. Remember, as a patient at Gateway Community Health Center, you have access not only to our pharmacy, but to all the great benefits that come with it, including delivery.
So you would go see your provider, be it in the pediatric department, adult medical department, or the dental department. They will fax either prescribe a medication to us, or they may give you a paper prescription. We will get it here in our pharmacy. The patient will in turn come and order his or her medication to let us know that they were going to come and fill it with us. We'll have it ready for them depending on if it's a chronic medication or if it's a medication for an acute illness. That will basically garner how fast the patient will get the prescription from us to them. And as you know, we are inside, so we are able to maintain communication with the providers. And I think that's one of the biggest benefits, is that we have access to whatever the provider has ordered for the patient, basically also past medications that the patient has been on. So we are able to, check thoroughly a lot better than I think in other opportunities.
Thank you, Dr. Banuelos, for breaking down the benefit of pharmacy for us. We're staying on pharmacy because as we move on, we're discussing low-cost medication options with Director of Pharmacy, Iracema Perez. All right, ladies and gentlemen, we are here at Gateway Community Health Center, and as part of us offering medical, dental, and behavioral health services to our patients, we also offer pharmacy services. And with me is our Director of Pharmacy, Ms. Iracema Perez. And Ms. Perez, thank you for joining us. I want to talk about some special programs for our patients today, but before we jump into all of that, tell me a little bit about the pharmacy services and what patients can expect from Gateway through becoming a patient here at the clinic.
Okay, great. So we do have a pharmacy, an in-house pharmacy at our main clinic, which is on 1550 Papas. We also have a pharmacy in our South Zapata Highway clinic. So those are to service our patients of Gateway. However, we also service patients who are in Zapata County as well as in Hebronville. Right. We also service patients who are in our Shiloh clinic. So what we'll do is we'll fill the prescriptions here out of the 1515 Papas, and then we will deliver the medications to those locations.
So like somebody comes here, they visit with their provider, they get a prescription, they can come right here to our pharmacy, which we'll kind of jump into right now in a second. But if they're a patient in Zapata, Hebronville, even on the north side of town, they can get a prescription filled from us here.
That's right. So the prescriptions are sent to us electronically. So they can be sent from Zapata, from Hebronville, from Shiloh, as well as our LC South clinic, which is one of the latest ones that we've added. So we will receive their prescription here, we will fill it, and then we will ship that out to that location, and the patient will pick that up over at that location.
We're grateful to Iracema for helping us understand that medication is affordable for all, but health isn't just about medication, is it? Up next, registered dietitian Marisa Benavides guides us on building a healthy plate. Check it out. Marisa, I want to toss it over to you because I want to know how to build a healthy plate, and you're going to show us, right? So tell me, what is it that my plate needs to have so that I can live a long, healthy life?
Okay, well, starting off, the basis of the plate should have vegetables. And this is a method called the Idaho plate method that helps us have some flexibility and can have some cultural variations in the way we build our plate. And it's a really nice tool because there's really no right or wrong way to eat, and there's not one set diet for any individual, but it gives them some flexibility. And so when we see this plate, we notice that half the plate is filled with vegetables. Do you eat vegetables regularly?
I try to.
Okay.
I try.
Should you be eating vegetables?
Every day or with every plate, yes. I think, right? So. But I'm looking back over here and I'm like, some of that looks good, but let's focus on this plate right here. This is the plate we need to focus on, okay?
Okay, yeah, so definitely cutting back on sugars is very important. Sugars are sometimes food that we should be enjoying on small occasions and small amounts, but we should be eating vegetables on a daily basis, and that's a big challenge for people. Sometimes they don't like it, sometimes they don't really know how to prepare it. And one of the things that I hear frequently from patients is they really don't know what to do with them. In their mind, Most of my patients are thinking of that bag of vegetables Normandy that come with the broccoli, the cauliflower, and the carrots. And, you know, maybe their mom steamed it for them and made them eat it when they were a kid. And so when I talk about eating more vegetables, that's not what I'm talking about. I'm talking about filling your plate with delicious, yummy, amazing tasting vegetables on a regular basis. And they can be frozen, but they can be fresh, they can be canned. It really doesn't matter.
And that was going to be one of my questions was, does it matter whether the vegetables are frozen? I buy frozen vegetables, fresh vegetables. Does it matter in what form they come or the way I eat them?
At the end of the day, I just need you to eat them. Whatever is easier for you and your preference, and that works, okay? But again, you know, sometimes we don't really know how to prepare them, and it takes a little bit of practice. And we do have classes on, you know, ideas on how to prepare them. But for me, Pinterest is my friend. I like to search yummy, delicious vegetable recipes and try maybe a new recipe once a week, once every other week, because if we were to make our vegetables the same every time, they get boring and they're just not that enjoyable. And so we think about chicken. It's such a versatile protein, right? And we can eat chicken every day, but we would never consider eating chicken boiled without seasoning on a daily basis. That would get old really fast. So we want to take that same approach that we apply to the chicken, and we can grill it, we can bake it, we can stir fry it, we can air fry it. You know, there's so many things we can do it. We can saute it with other vegetables.
Do the same thing with vegetables.
Exactly. And so we season them differently, and chicken can be eaten every day. And so if we take that same mentality and apply it to vegetables, then of course, now they're yummy and delicious and enjoyable. And it's a little bit easier to get ourselves to do that. But it does take practice. It's not something that if you're not used to eating vegetables that you're going to be great at from one day to the next.
Our thanks to Marisa. Always fun when we get to hang out with her. And of course, a healthy plate calls for buying and cooking healthy food. We'll discuss that next in this segment that took us shopping at the grocery store. Check it out. So we're in the fresh produce aisle right here at the grocery store, and we've got that list from our registered dietitian, Marisa Benavides, who shared with us what it is we need to add to our shopping cart. This is the first place you want to hit when you walk inside the grocery store. So you'll see you got asparagus, you got beets, you got celery, you've got spinach, you got lettuce, my favorite, fresh broccoli, you've got cabbage, and you've got all these fresh greens that are gonna contribute to a healthy lifestyle. If you keep going down, you've got carrots, you've got mushrooms. Those are all the things you wanna add to your plate, whether it's breakfast, lunch, or dinner. They all need to have a fresh set of greens to that plate. My favorite has to be the asparagus. Add a little olive oil to your pan, salt, pepper. You can bake them, you can pan fry them, you can grill them outside. And I will say they are super delicious, super tender, and super healthy. So part of building a healthy plate includes some starch, but I want to talk about these starches specifically: corn, beans, potatoes. All of those should be limited to a half cup only. So any potato, any sweet potato, all of that should be limited to a half cup on your healthy plate. All right, so we're talking about proteins right now, and one of the leanest proteins that you can get in terms of red meat is sirloin, top sirloin that is. Now, what's really cool about sirloin is that it comes in different variations. You've got strips, your sirloin strips, but they also make it into fajita style. So sirloin can be cooked in many different ways. It's a lean red meat, and one of the meats that you should also limit when it comes to portion size. You definitely want to cut your portion size down to only a quarter size of the plate. Everything else should be all greens. All right, over red meat, I will say you are better off picking either chicken or fish. Fish being the preference. Now, when it comes to protein, you want to limit it to a quarter size of the plate only. Season it to perfection, grill it, pan fry it. Either way, fish is the way to go, and you want to limit it to a quarter size of the plate and fill it up with healthy vegetables. So one of the big questions that I asked Marisa Benavides, a registered dietitian, about was whether I could eat frozen vegetables and still get the same nutritional value. And the answer is yes, you can. And one of the things that I love about eating vegetables, frozen vegetables that is that they're simple and easy to make. Throw in a little olive oil, throw them into a pan, season to perfection. They come out tender, delicious, and you're getting your nutritional value, maintaining your healthy heart, and maintaining your diet. That really was a fun time at the grocery store, and I hope you got a chance to learn about eating healthier. Well, next up, we're switching gears to the topic of mental health, specifically with licensed professional counselor associate Berenice Toruco, who gave us a holistic approach to health on our previous episode of Gateway Today.
So definitely, I think you need to take the time to take time for yourself to recognize those feelings. And once you recognize your feelings, just identify like, why are they making me feel like this, or what is it that makes me feel like this? And then follow up with, what am I going to do about it? So breathing would be one strategy. There's many others depending on individuals and personalities that can be recommended, but something that I like to pair with the breathing, my personal recommendation, is physical activity. And that doesn't have to be as far as go to a gym and exercise. It can be something where spend some time outdoors, go for a walk, breathe in some fresh air, and be mindful about the experience around you. Pay attention to your surroundings and create that awareness. Nature exercises can also be very beneficial, such as grounding, like just take some time to walk outside barefoot and feel how the earth feels under your feet. Things like that. They can be very simple, but at the same time, they can also be very powerful and really help you to ground and de-stress.
We were so grateful to Berenice. We wanted to take Gateway Today outside, and so we headed to the park for some breathing and reflection. Follow us on this segment. Check it out. It's a beautiful day in the city, and we decided to take the show outside of the clinic. And at Gateway Community Health Center, Behavioral Health Services is one of those services we offer to patients who are dealing with mental health issues, and our licensed professional counselor, Berenice Toruco, recommended that we would reflect, we breathe, and we exercise so that we can improve not only our mindset, our mental health, but we could reduce our stress. So we're gonna show you how easy it is. So follow us, let's get out of the house and let's enjoy the park. So as part of the reflection process, Berenice Toruco, our licensed professional counselor, recommended that we think about our goals, we think about things that are important to us in our life, and I wanted to find a space that would allow me to do that. So I put my phone down, put it away, put it on silent, put it in airplane mode, found a spot here at the park, found a place that was just an area where I could connect with myself. I'm enjoying the sounds. I'm enjoying the scents, the outdoors, the sun hitting me. And all of this is just contributing to the ability for me, myself, to reflect on my goals, the things I want out of life, and I feel pretty good. By now, I know you must be asking, how can I become a patient? Well, I'm glad you did, because here's a chance for you to take out your phone and become a patient or set up your next appointment. We're making it easy for you to access healthcare. Just, again, take out your phone and go to gatewaychc.com. Just type in gatewaychc.com on your phone or on your computer. Couple things that I want you to notice when you get to the website. At the very top, if you click on this number, this will actually allow you to call Gateway Community Health Center directly, simply by clicking on the number. We're not going to do that for this demonstration, but just want to show you what capabilities are available. The other thing you want to do is click on the email. If you would like to send us an email, you can email us directly, and that will also open up your email browser on your mobile device if you have email enabled. Now, how do you become a patient? Well, very simple. There's a couple of ways to do this. One is simply by scrolling down and clicking Become a Patient. You're going to click Become a Patient, register online. That will then open up the registration form, and is a very simple form. You don't need a lot of information. Simply your name, last name, date of birth, where you live, email, or click no email if you don't have one, phone number, and then whether you have insurance or you don't have insurance. Remember, we take everyone. We never turn anyone away, no matter their ability to pay or not to pay. Everyone is welcome at Gateway Community Health Center. Now, the other way to get to the registration portal is by clicking on the three lines, also known as the burger menu. Click on that. It's going to open up all these different options. Scroll down to where it says Become Patient. And again, it'll take you to the same window. Just again, click Register Online, follow the prompts, and then you will receive a phone call from Gateway Community Health Center to set up your appointment. Now, you can also use this to set up an appointment if you're an existing customer. So you can also use this form, the Register Online form, to set up your appointment as well. Or you can also call the clinic directly and set up your appointment over the phone. The other option you have is to simply come on down to Gateway Community Health Center or any one of our clinics. And if you want to find those locations, you can simply come on over to our locations, and all of our locations are listed for you here on our website. You can simply walk into any one of our clinics and you can get seen that day. So walk-ins are always welcome. No appointment is necessary. However, if you are a planner and want to make sure that everything is set and done and skip the wait and the time, then make sure you start by becoming a patient, clicking Register Online, filling out the form, and the process is as simple as that. And very soon you're on your way and one step closer to becoming a healthier, better you. Again, the website to visit is gatewaychc.com. We sincerely would like to thank you for reliving these episodes with us, and thank you for allowing us to come into your homes with our show. We remind you that if you would like to experience this comprehensive health care for yourself or for your family, please visit gatewaychc.com to become a patient today. We accept all insurances, including Medicaid and Medicare, and serve those without coverage, regardless of their ability to pay. We're committed to providing high-quality medical, dental, and behavioral health care to all. No appointment is necessary, and simply walk into any of our clinics. For a full rewind of this episode and all other episodes of Gateway Today, make sure you head over to our YouTube channel and don't forget to smash that subscribe button. Thank you again for tuning into this episode of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.